welcome to the Well Child Show. Good afternoon and welcome to the Well Child Show, brought to you by Global Child Health and Safety Initiative. I'm so glad that you've decided to spend today with us on your program that brings you education and information on global best practices in childcare health and safety. Today on the show, we're going to be discussing a topic that is really binding on a lot of our lives. We're looking at the phenomenon on what we call special needs children. And I have someone, a very astute professional with me in the studio today who will do justice to the topic. Let's go on this very quick breather and we will be right back. Stay with us. You're welcome back. If you're just tuning in, it's the Well Child Show, brought to you by Global Child Health and Safety Initiative. And my name, as always, is Kemak Onyenuchea. I'm your host. Thank you for spending the day with us. Right, on today's edition of the program, we're going to be looking at the phenomenon called autism. And I have a very well-heeled and versed professional in the field of autism who will take us through the discussion today to help us better understand the phenomenon that we know as autism. Joining me in the studio today is Omotoke Olowo Olugbode. She is an inclusive educator, a tech innovator, as well as the founder of the Autism Awareness Foundation. You are most welcome to the program. Thank you so much for very short notice, and then you made out time to be here. We don't take you for granted.
Thank you so much for
Right. So, like I said before the show, I am actually a novice on the topic of autism, and I remember at my last trip abroad, I decided to do a class in autism to better understand it, but something happened that affected my ability to do that. So I'm much as excited as I'm sure the viewers are to learn one or two things about autism. So let's start from the very basic. What is autism?
Okay, so I think one of the things that have differentiated autism from every other disability is the fact that autism has no physical features. I like to start with that all the time. So, a lot of people go about that, oh, this child is normal in course, there is nothing wrong because they can't see any physical form of disability, but that is not true. And that's what makes autism a neurological disability. That is, it affects the developing child, the brain of a developing child. So the brain of the child is affected while every other thing about the child is okay. So you can see a child, the eyes, they can see, he can hear, he can smell, the two hands are there, and there's still something missing, and people go about what exactly is missing. So we try to let people know that autism is a neurological developmental disability, which basically affects the brain of a child. Right.
Okay, now looking at it, because the brain seems to be like would I say, like, in the car there's a battery that powers everything. So is it safe to say that the brain occupies that position in the human body?
Of course, definitely. The brain is what we use to process the information we receive from outside, how we also respond. And so because the brain has been affected, it's automatically affected the totality of the child.
Wow.
So it's like one part of the child is affected, which is the brain, and the major component of the body is spread out to affect every other area.
Yeah, that's right. Because if I remember my biology well, the brain and the central nervous system. Right? Exactly. So autism essentially is a developmental disorder that affects the brain. Exactly. Now, is there any reason, like, for example, cancer. The doctors tell us there's no known cause of cancer. It's just a rapid multiplication of cells. Speaking about autism, is there anything that triggers that disorder?
And that is one of the questions that I would say that is like one of the most asked questions when it comes to autism. There is no specific cause.
Wow.
There is no known cause yet, and that is why it is a condition that cannot be cured.
Wow.
So I've seen parents, when they say their child is on the spectrum, going from churches, going to different places, this disability cannot be cured, but it can be properly managed.
Right.
If parents get to know very early, they get to know what to do at a particular time. So there's no known cause, but there are some predisposition factors that people have said could have been the cause of it. Okay,
can you tell us a bit about some of these factors?
Okay, so one of this is hereditary or genetic. It is believed that autism is hereditary or either genetic. You know, we have the genetic components in our body, and it is believed that when these components, you know, maybe the child have this same component from the parent, either from the mother or from the father, the child might turn out to have autism. You know, I've seen families whereby they have a first son who has autism, and they give birth to another child who also has autism. So sometimes it can be like that. In fact, sometimes a parent can have all their children on the spectrum. And that is why one of the factors is that it's either hereditary or genetic. Another factor is the environment. You know, the environment also determines a lot of things that we do, what we eat, what we take in. Everything we do is from the environment. So sometimes the environment also affects and make a child, you know, being born to have autism. Sometimes it could be toxic substances. It could be fleas, it could be perfumes, it could be X-ray. So things like that.
So aerosols generally that the mother inhales
during pregnancy. And it's not as if the mother intentionally inhaled those things.
Because I mean, no mother would want to have a baby that has a challenge.
So, and that's why we try to also tell parents, when your child have a disability, it is not your fault. Stop putting the fault on the mother or on the father or anybody that saying it's because you did this. That is why the child ended up having this. No mother will wish that on his or her child.
Wow. And you know, you just touched on something. I'm going to ask, because you mentioned earlier about early detection. Now we're going to ask that, but you just touched on something now that I feel is really important and critical for us to flesh. The issue, like the psychosocial or the emotional burden that comes with having an autistic child. And of course, in our part of the world, there's a lot of superstition. You know, people hold on to all these traditional beliefs that have no roots or, you know, proof to make them tangible. Mothers who have autistic children, or families generally who have autistic children, there seems to be some stigma attached to that, from blaming the mother or blaming some ancestor or something. So can you just throw more light on this?
I think that is another, for Nigeria as a country or Africa as a whole, I think that's one of our major problems. We attach everything to the mother has either offended somebody when she was pregnant, she has either abused somebody, or the village people in Code, you know, has either done something to, and that is why for a long time, rather than for parents to seek, you know, medical solution, they go about taking these children to churches. I'm not against going to churches, but I'm saying doing it the right way. You know, people have come to say it's because you took this particular drug when you were pregnant. All these things are just speculation, because research has not really given us something to say this is what causes
the reason.
Autism. So what I would just advise parents is, you know, try to bring yourself together, and you know, you have to just let yourself know that as a parent, you will not intentionally want to harm the child. It is not possible. So if people could just allow parents to just be, it's going to go a long way. You know, we've seen places whereby a parent is trying to take a child to a particular school. You know, other parents in the school, we either take their children away from that school, saying, oh, my child cannot be in the same school with a child with autism. My child cannot be in the same class with a child with disability. That is stigmatization. And that is why we further widen the gap of stigma. People are doing their own. A lot of children with disabilities are not being included. Which makes it very difficult for parents. In fact, some parents have lost their job, especially mothers, because school won't accept these children, other places won't accept them, so the mother is left alone with the child at home. In fact, I've seen severe cases where some mothers will have to lock their child inside the house and go out, either go to work, go to the market, because nobody,
because of the stigma that's attached.
They don't want people to see their child. In fact, I've heard cases whereby people call children with autism that they are either insane or mad. You know, these are things we try to correct. These are notions we try to make people understand that the only form of disability that we know are not only physical disabilities. There are people who look just like you, but that doesn't mean that they don't have their own disability. So you have to understand. That is a place where understanding comes in. Be empathetic towards parents. When a parent comes to you, don't go all, oh, it is because you did this. Try to hear them and try to provide support. You might not have the medication to give them, you might not even have money, but providing that emotional support will go a long way to help parents. Okay,
now before we go on the break, I want us to talk about early detection of autism. Like, are there medical tests? What can parents look out for in their children that can give an inkling that the child could be autistic? And before you say that, I just want to give a disclaimer. Please, parents, some of the things she might mention, you might observe in your child. Don't conclude that your child is autistic. Don't panic. You know, if some of the information she's going to dish out now, you observe them in your children, go for further medical exams, meet the professionals. Of course, we're going to give her number at the end of the program so that those of you that want to get in touch with her, you are free to. So yeah, are there early signs?
Yeah, thank you so much for that. And I think one of the things I try to tell parents all the time is, as a parent, you have to make sure that all your 5 senses are at alert. When your child is growing up, there are developmental milestones that the child is supposed to achieve at certain age and a certain time. So if you see that your child has not achieved such developmental milestone, you should note it down. You should be able to speak to your doctor the next time you go for an appointment. Even if it is not a doctor, if you know a nurse or somebody who is a medical professional, just let them understand. It might not be anything. It might just, sometimes some children are delayed.
They're just delayed for no reason.
Sometimes they are just delayed. They are not achieving it at that certain age, but it doesn't mean that they won't later achieve it. And that is why before you can go for a complete assessment on autism, the child has to be around 3 years of age. Yeah, because at that time the child will have been able to develop some skills over time. And you please do not, just like the disclaimer, do not look at one part. Oh, she said if the child cannot talk. Some children with autism, you know, bright lights, loud noises are things that really affect them. You know, touching them when they are not supposed to be touched and talking over their heads are things that they don't like. They don't make eye contact, just the way I'm looking at you. Some of them might not make eye contact. Some of them might withdraw into themselves, like not playing with other people or playing in such a way that you just know that this is not the way a child should play. And some of them might be non-verbal. That is another major characteristic, that is, they cannot be able to, because autism actually affects 3 major area of the child: the communication, the behavior, and the social interaction. So once you see all these things that your child is not achieving it, please do not sit down at home and pronounce your child as being on the spectrum. Go for an assessment. And an assessment can be conducted by an occupational therapist with the help of a doctor and other therapists, behavioral therapists. We have speech therapists. There are things they will measure. There are things they will look out for before they can say, oh, this child is on the spectrum. And that is why autism is called autism spectrum disorder. It's like a scale. Some children might be very mild, just some little things that need to be done and the child is okay. While some might be on the higher scale, which is severe. So do not sit at home and say, oh, they said if the child is afraid of light, then that means no. You have to go for an assessment. And that is why most times before, when parents come to me complaining, I tell them, have you gone for an assessment? Do you have a report? Let me see. Because without that,
there's really nothing that can be done.
You cannot just conclude.
Yeah, and I think we need to educate our people, Nigerians, Africans, on the need to take medical exams seriously.
Very important.
And the need to stop self-medicating. A lot of us are on this table, so let's shatter the table. Don't self-examine. Go to a trained medical professional. Now, back to the symptoms of autism. You mentioned a few things: aversion to bright light, delayed speech, delayed sensory and psychomotor movements, aversion to touch, Are there some other, signs that could tell?
Okay, so like I said, it affects the brain, and we know that our brain is made up of 5 senses, though we have 7 actually. But generally, every one of us know about the 5.
Can you mention these senses?
Senses. We have the height, that's the sight. Sometimes you can see that the child is maybe avoiding light or like to stay in the darkness. It could be in different form, and that is why you cannot look at a person with autism and use it to generalize. There's a saying that says that if you have met one person with autism, you have met one person with autism.
Right.
It is different. Each person exhibits
in different form. Wow.
So why another person does not like bright lights, some of the children are actually attracted
wow.
to this bright light. So if I say if your child does not have bright light, that means your child has autism, and your child does not have, and you conclude it. So it's not like that. So you have to really look at like an holistic approach to it.
Which is why we keep insisting medical professionals have to do
very important
the test.
So when it comes to the nose, some of them cannot actually smell. They cannot even smell. In fact, we've had cases whereby some of them, we even touch their feces because to them it's not actually smelling.
Right.
And some of them are very sensitive to smell, so that if they perceive any little thing, it could cause a tantrum or a meltdown for them. So it depends on. And some of them cannot chew. That is when it comes to the mouth. Some of them avoid some certain food, maybe vegetables, maybe carrots, apples, especially things that will make them chew. So these are things sometimes, parents, when you give your children fruits and they are not eating it, watch out. Why is he not eating it? Have you tried to cut the fruit into different sizes or shapes so that the child can get attracted to it? We also have the ears. Like I told you that it also affects them in the non-verbal aspect. And another major important part is vestibular, that is their balance in space. Sometimes some children with autism might think, maybe I'm fatter than the way I am. So when they want to pass, they might not even see you. They might bump into you. And some of them, I think they're actually slimmer. In actual sense, they're actually fatter. And they might be trying to pass through a very tiny place. And you're like, this place is tiny for you, but to the child, it actually
the child feels I can go through. It's just a wide, no wonder it's called the spectrum, because there's no, unlike malaria, we know the symptoms. It's this fever, headache. They're just set. But wow. So and that is why we tell parents all the time, your child might be exhibiting some, it might not even be autism, we have some other related disabilities, so that ADHD, you cannot just conclude because the child is not doing some things. No, you have to really take this child for a test. Go for an assessment, be sure that it is certified. That puts your mind at rest, and that makes you to know the next step to take. Right, so we're going to go on a quick break, and when we come back, the show continues. Now, to my viewers, there seems to be a lot of laxity in the town about the coronavirus. Please, we are appealing to you. Take this seriously. Don't be paranoid, don't be pessimistic, but you need to take your personal care extremely serious. Coronavirus, despite the ease of movement, is not on lockdown. The disease is spreading like wildfire, so we're bringing you this piece of information on how to take care of yourself and prevent the spread of coronavirus. Stay with us, we'll be right back. You're welcome back. If you're just tuning in, it's the Well Child Show, brought to you by Global Child Health and Safety Initiative. And my name is Kemak Onyenuchea, your host. Today on the program, I have Omotoke Olowo Olugbode. She is the founder of the Autism Awareness Foundation, and we're treating the topic Understanding Autism. You're welcome back to the program.
Thank you so much.
I'm so, happy. I'm so excited to learn. Like I said, I had a very serious interest in gaining training on autism, but this is almost like a master class. So you send me your invoice. Right. Now, when we went on the break, we were looking at the expression of talent observed in children with autism. Now, of course, as it is with life, there's an upside to everything.
Sure.
Right. So, and I remember I once took a tour. I once saw a facility in the States where children with autism were being, would I say, groomed. It was like a resource center, but catering to children with autism. And I tell you, the arts and the crafts that these children made were the most exquisite I'd ever seen in my life. And you were just telling me that because autistic children usually thrive on repeated cycles. Can you just let me not take the words out of your mouth?
Okay, yeah. Just like you mentioned, like to everything there is an upside to it. We've had questions over and over again where parents are like, are you sure my child will be able to live independently? Are you sure my child will be able to, at least be able to make out something for himself? And this is what we tell parents. See, if your child has autism and you start your intervention, your therapy at a very early stage, there is 95% assurance that this child can go on to become someone in life. And just like the way autism is, for those of them who are intelligent, or for those of them who are savant, who have like high IQ, they are so good on a particular thing and they do it so well. For example, it could be music. Some of them could play the keyboard even without learning it. They could just play it on their own. Some could paint or draw without learning. You don't need to teach them. In fact, saying you once, just once, it's enough for them to go to their drawing board and reproduce exactly what they have seen. So it happens like that. And if parents can discover that skills in their child and they can work on it, and that's what we tell parents, look at the positive side of your child. Stop looking at the negative. Because if you continue to see autism, before you know it, the years have gone, and the only thing perception. And the only thing you are seeing is autism. But if you begin to see, okay, yes, I know my son has autism, I know my daughter has autism, but what other things can this child do? I've seen, in fact, I recently met somebody in 2018, he is a data analyst and he's on the spectrum. That is what he do, and he do excellently. I saw somebody, you just tell him the day, tell him something like January 5, 1985. He will tell you if it is on a Wednesday, if it is on a Tuesday. So you have these skills in them. Just look at that bright side of it and stop looking at the negative part. Oh, my child can't do this. Look at what the child can do. And you know what, okay, it's quite funny because even for children who are quote unquote normal, everyone has a special skill and something they are not great at. Exactly. So for example, I sing very well, but I'm not a very good soccer player. So or I'm not good at figures, like mathematics is just not my thing. So in the same way, an autistic child could be great at cognitive ability, remembering things, and has his own, downside with possibly interaction. So what you're saying is actually correct. It's all about perspective, how you see the child. And I think if parents could adopt this mindset of not seeing autism as some huge evil that has befallen the child, I think that it's going to go a long way to solve about 80% of the problem. Trust me, because that is one of the problem, the perception. Even sometimes when parents are even doing therapy, they are spending a whole lot, they still go about with this mindset. And I know it's difficult. I understand how that can affect them. But the truth of the matter is, no matter how much parents dwell on this problem, it is not going to go away. It is a lifelong developmental disability. The only thing that can be done is to ensure that it is properly managed. Therapy are being done on time so that the child can at least harness a whole lot of learning to be able to live independent life. And I've seen adults with autism who has gone on to live independent life. So it is possible. It is possible. Parents just need to, continue to show up for themselves.
Right. Now, before we go, because I think we have about 5 minutes left, can you tell us what are some of the things that parents can do to kind of like improve the living condition or the life outcomes of their children, should they have autism or should they be on the spectrum?
In fact, with recent happenings of COVID-19, a lot of children have had to stay at home with their parents.
Right.
And we see that most times parents don't really know what to do with their child. But the truth of the matter is that as parents, you need to learn some of these things. You need to learn, when the child is having a meltdown, what should I do? How can I help? How can I step in? There are some things that parents can actually do at home. And I think one of the major things is watch out for your child. Know what triggers, some certain behavior in them, and try to avoid it. And I think another thing I would tell parents is make your other children, if you have other children, make them the best friend of your child with autism. They can help a long way. I've seen children with, neurotypical children going out to help their friends with autism, blending them into the society, playing games, allow them to do house chores if they can. It's a form of exercise. It helps them. So don't be like, oh, because my child, don't just sit down, don't do anything. No, make sure the child is included in some little house chores, jumping, singing.
I'm really excited about this.
Dancing.
In 1 minute, sorry to cut you short, can you talk about inclusive education? Because I must confess, at the first time I came in contact with that idea, I felt some type of way. But then I had to take myself back to understand that I did not grow up in an environment that practiced inclusive education. So tell us a little, just in 1 minute, about inclusive education.
So basically, inclusive education is allowing every child to learn together in the school system. No rejection, no discrimination.
Now, what's the basic, the number one or the major advantage of inclusive education?
One of the major advantage of inclusive education is the social interaction aspect of it. Trust me, a lot of us grew up never seeing somebody with Down syndrome. A lot of girls grew up never seeing somebody with cerebral palsy, and that is why our government goes on to make laws that are not even accessible for people, because they believe that people with wheelchair do not go to work. We have buildings without ramps, without escalator, without elevator. If children grow up in an inclusive educational system, they see their friend with wheelchair, they already know that there are some people that uses wheelchair. So when that person grows up to
it's not new.
It's not new. So when that person grows up to become somebody in power and needs to build a particular, building, he remembers, oh, if my friend on the wheelchair is coming to this place,
he needs a ramp. Now, yes or no answer, and we'll wrap this up with this. Autism and Down syndrome, are they the same thing?
No, they are not.
It's okay, you're coming back next week because we need to continue this discussion.
Thank you
so much for being on the show today. And thank you to you viewers for spending the time with us. You've heard it all from the professional. Autism is not a negative thing. It just shows that, as with every other, we call them different ability, right? So if you have a child on the spectrum, get the help you need. It's not a sign. No one is punishing you for something, whatever you did in the past life. It's just another phenomenon that we have in life. Thank you for being a part of the show today. Our phone numbers are on the screen. For potential sponsors and partners, we're calling on you. Help us keep this program on the air. And of course, conversations continue across all our social media platforms, on Instagram at The Well Child Show and at Global Child Health. And if you have questions and comments, you can send us an email to info.wellchildshow@gmail.com. Call the numbers on your screen to get my okay, before we go, can you give them your number if someone wants to reach out to you?
Okay, in case parents want to reach out or any other person, my phone number is 07062204464.
Thank you so much. And always remember, child health and safety is everybody's business. Goodbye, and I'll see you next week.